Switching your Medicare supplement plan without any underwriting sounds great, right? Well, in some states you actually can. I know we've said over and over again that you have to go through underwriting to change your Medigap plan, but in some states it's actually different. Hi, my name's Hannah Skinner. I'm a licensed insurance agent at the Senior Savings Network, and today we're going to be talking about birthday rule states. What they are, which states have them, which new states are getting them, and how they could have consequences such as high premiums. Now it's time to look at how these actually affect you. It sounds really great to be able to switch your plan any time of the year, but this does affect premiums. New York, Connecticut, Washington, those states with year-round open enrollment, you tend to see very, very high rates. We've all seen the cost of Medicare supplements go up tremendously in the last few years, and there's several things that we could blame for those increases, such as increased frequency of hospital visits, how much things cost nowadays, and birthday rules. If we take a look at the average Medigap rate increase trends for all states and all carriers from about 2020 to 2026, you can see that it has gone up. And we've even seen in other states rate increases as high as 40 and 50%, but this is just the average. When we look back at 2020 during COVID, people weren't using their coverage as much. They weren't going out of the house, so they weren't going to the doctor's office. So we saw very low rate increases. Plan F about 6% on average, Plan G about 4%, Plan N about 3%. But you can see as the years go on, it starts to get higher and higher. So right now, it's in the double digits for both Plan G and Plan F. Plan N has stayed in the single digits, which is why we've always recommended it. And again, these are even higher with some carriers in some states. Now, I want to show you what I mean when I say that these birthday rule states can cause major increases. If we take a look at this graph that I put together, you can see every single state when it started, how much the Plan G and Plan N cost when it started, and how much it costs now. The reason that we see rates go up so much in these birthday rule states is because people are able to switch with no underwriting. So someone could be very, very sick on a Plan F, and maybe they've been on that Plan F for 15 years, so their premiums have tripled. If they want to switch to a Plan N because it would save them $200, $300, $400 a month, around their birthday, they can. And with open enrollment states, they can do it any time of the year. This leads to Plan N, Plan G, those plans that don't have as many sick people in them. They now have more sick people in the pool, and the companies can't do anything to mitigate this cost. So if you look at this chart, you'll see when Plan G and Plan N started out, I think the biggest jump was New York. In New York, a Plan N around the time that open enrollment started was about $140 to $190 a month. It's already pretty expensive for a Plan N, considering in most states it's between $70 to $150 a month. But then you look at now, 2026, those plans have gone up tremendously. There's only about 5 or 6 carriers that even offer the Plan N in New York anymore. It's become kind of a monopoly. So we see that that's gone up from $140 to $190 to $220 to $320 a month for a Plan N. But the bright side is, if they want to switch to a high deductible G later on down the road to save more money, they can. There's pros and cons to it, but you'll see that the rates increase tremendously in these birthday rule states. Another state where we've seen this kind of skyrocket is Washington. Washington is open enrollment as well. So Plan G started out around $145 to $190 a month before the annual enrollment was put in place. Now the Plan G is between $210 to $290 a month. And the people in Washington, they really feel that. We have so many people in every state, but Washington, Connecticut, New York, California, all of these places where the birthday rule or open enrollment rule have been put in place, and they do change their plans yearly. They kind of have to. I mean, if your rate is going up 10, 20, 30% every single year, and you can keep switching that plan over and over again, no matter what your health conditions are, why wouldn't you? For the companies in these states, we start to see them, they're kind of leaving. And like I said with New York, it's creating a monopoly. And when there's a monopoly, they can charge extreme amounts. They affect your premium, but the good thing is you can take advantage of them. There might be a company that's lower, and remember, the Plan G is the same Plan G no matter which company you go with. So if you're paying $250 a month for a Plan G in California, and you can get the same Plan G for $150 a month, why are you not taking advantage of that? That's what we do here. We look at every single company and we're able to tell you, how much their plan in is, what their rate increase history is, how much we can save you moving from plan in to plan in. If you like Plan G and you don't want to switch to a different Plan G, you can stay on Plan G and there might be a less expensive Plan G. Or if you've been on Plan F since it came out and you don't go to the doctor as much and you're looking for something maybe with a little less coverage that's going to cost you a whole lot less, you could switch from Plan F to Plan N in these states with no underwriting. Another thing to note is just because these, birthday rule states, they have these rules where you can change with no underwriting around your birthday, you can still change your plan any time of the year. You don't have to wait for a particular time of the year. If you don't do it around your birthday rule or the anniversary rule, you will have to go through underwriting. And again, like I said earlier, on these plans where you can go from, the same plan of equal or lesser benefits, if you want to go from the Plan N to the Plan G in a birthday rule state, you can still do that, but you do have to go through underwriting. These just give you a loophole where if you want to go down in coverage or stay the same in coverage and you want to pay less around your birthday, you might have to wait the year until your birthday, you can do that. Let's go ahead and start with the new birthday rule states. There are about 7 proposed states: West Virginia, New Mexico, Minnesota, Michigan, Ohio, Pennsylvania, and New Jersey. So West Virginia it has been enacted as of June 2026, so June 1st. With this plan, you can switch to the same plan or a plan with lesser benefits without underwriting. So you can go from Plan G to Plan G, you could go from Plan G to Plan N, but you could not go from Plan N to Plan G without underwriting. For New Mexico, this one has also been approved for January 1st of 2027. You can switch to any Medigap plan with equal or lesser benefits without underwriting. So again, Plan G to Plan G, Plan G to Plan N, Plan F to Plan N, but you cannot go from Plan N to Plan G or go from lesser benefits to higher benefits. So in Minnesota, as of August 1st of 2026, they're introducing a one-time guaranteed issue enrollment period. So Minnesotans between the age of 65 and 70 can now enroll in or switch to a Medigap plan during the fall annual enrollment period without medical underwriting. However, it looks like this plan is going to have a premium penalty. The next is Michigan, which will also be a birthday rule. We don't know when the proposed effective date is, but we do know that the annual window will be 60 days surrounding your birthday. You can go to any carrier that you'd like to, but it does have to be the same plan. So you can go from Plan G to Plan G or from Plan N to Plan N. The details on this one are still being determined, as with a lot of the rest of these. The next is Ohio. Again, this one is going to be any carrier, but same plan only. So Plan N to Plan N or Plan G to Plan G. This has also proposed a 60-day annual window surrounding your birthday. Then we have Pennsylvania. This one, the proposed effective date is actually January 1st of 2027. Again, it's an annual window, 60 days surrounding your birthday. And this one is going to be any carrier with the same plan or variation only. More to come on that. They didn't quite specify what variation means. Then we have New Jersey. This one is actually supposed to be a continuous enrollment period, kind of like New York, where you can switch between any carrier, any plan. So you could go Plan F to Plan N, high deductible G to G, G to N. You can do any of this any time of the year with no underwriting. There isn't a proposed effective date for this one quite yet, but if it is passed, it'll be very similar to New York. So now that we've talked about the consequences when it comes to premiums in these birthday rule and open enrollment states, I think it's important to point out that in New Mexico, West Virginia, Minnesota, Michigan, Ohio, Pennsylvania, New Jersey, these new states that are getting these birthday rules and annual open enrollment rules, you will probably see higher rates in the next few years. That's something to be on the lookout for. You might get a 20, 30, 40% increase, and you probably won't know what's going on. It might be the birthday rule. As people start to switch and these companies are responsible for taking on these people that could be sick and they could be making the pool spend more money, you're going to see your rates go up. And it's really important that you take advantage of these rules that are put in place for you. Yes, it will raise your rate, but you can shop every year on your birthday or on your anniversary, whatever the rule in your state says. You can shop every year and get a lower price. So now on to the states that already have a birthday rule. We have California. In California, you can switch 30 days before and 60 days after your birthday. It's any Medicare supplement of equal or lesser benefits, meaning you can go from Plan G to Plan N or Plan N to Plan N, but you cannot go up in coverage level. Then we have Delaware. Delaware is also a birthday rule. You can switch 30 days before or after your birthday, and it does have to be the same or lesser plan with any carrier, so the same as California. Next, we have Idaho. For Idaho, you have 63 days beginning on your birthday. And again, it's an equal or lesser Medicare supplement plan with any carrier. Then we have Illinois. Illinois is a little bit different. It's a birthday rule, but it's only for ages 65 through 75. So it's 45 days commencing on your birthday, and it must be effective within 90 days of your birthday. You can go to any Medicare supplement of equal or lesser benefit, but it does have to be within the exact same brand. So that means if you have a Mutual of Omaha Plan G, you could go to a Mutual of Omaha Plan N, but you can't go from Mutual of Omaha Plan N to a Mutual of Omaha Plan G, and you also can't go from a, let's say, Blue Cross Blue Shield Plan G to a Mutual of Omaha Plan G. It has to be the exact same carrier brand. This one is a little tricky. It means that not a lot of people can use it, but we have been able to use it in some cases. The next one is Indiana, and this actually started January 1st of this year. You might have seen, we made a video on this earlier this year. This plan, you can switch 60 days at or after your birthday. So it starts on your birthday and lasts for 60 days. You can go to the same plan letter with other carriers. So you can go N to N or G to N, but you cannot switch throughout the plans. Up next, we have Kentucky. Kentucky is also a birthday rule. It is 60 days on or after your birthday, and the effective date has to be within 30 days of your application's signature. You can switch between the same plan letter with different carriers. So again, it's only Plan G to Plan G or Plan N to Plan N or even Plan F to Plan F, but you cannot switch between the plans. Then we have Louisiana. Louisiana's switching period is 63 days beginning on your birthday, and you can go to any Medicare supplement of equal or lesser benefits, but it does again have to be within the exact same carrier brand. So Humana to Humana. This does make it a little bit harder to switch, but there are still some cases where this comes in handy. Next, we have Maryland. In Maryland, you can apply on your birthday or 30 days afterwards. It can be an equal or lesser plan letter with any carrier. So again, you can go G to N to N, but you can't go up in coverage like N to F. Now, you won't see Missouri on this graphic, and that's because it is a little bit different. It's an anniversary rule. Most of the other states are birthday rules, but with Missouri, you can change your plan on the plan's anniversary date. So even though your birthday might be in May, if your policy started, let's say August 1st due to late retirement, August 1st will be the date that you can do your anniversary rule switch. It is within 30 days of the policy's anniversary date, so either 30 days before or 30 days after. You can switch to the same Medicare supplement letter with a different carrier. So no swapping in between plan letters, but you can swap between carriers. So next we have Nevada. Commencing with the first day of your birthday month and remaining open for at least 60 days after, you can switch to any Medicare supplement of equal or lesser benefits with any carrier. So for this one, again, you can go any carrier, any plan, but it does have to be lesser benefits than what you had before. Next, we have Oklahoma. For Oklahoma, you can apply on your birthday or 60 days afterwards. You can go to any Medicare supplement of equal or lesser benefits, just like we talked about before. Then we have Oregon. Oregon is a little bit different. It is a birthday rule. It starts within 30 days of your birthday, so either 30 days before or 30 days after. But here's where it gets a little tricky. Plan G can go to any equal or lesser benefits with any other carrier, but high deductible G can only go to high deductible G. Plan N can only go to Plan N, so on and so forth. We have a chart that I'll link below in this video where you can see, based on what plan you have now, what plan you can switch to without any underwriting. Up next is Utah. Utah is a 60-day window starting on your birthday. You can switch to any equal or lower plan with the same carrier. So again, you have to stay with the same carrier, but you could go F to G or G to N. Next, we have Virginia. For Virginia, you can go to any carrier, but it has to be the same plan letter. For example, Plan N to Plan N. You can do this on your birthday for up to 60 days after. And last but not least, we have Wyoming. For Wyoming, it's any equal or lesser benefit plan with any carrier. You can make this change on your birthday up to 63 days after. Now onto the open enrollment states. Open enrollment is different than a birthday rule because with open enrollment, you can change any time of the year with no underwriting. First up, we have Connecticut. Connecticut, you can go to any Medicare supplement plan with any carrier any time of the year. If you live in Connecticut, you'll see your prices are a lot higher, and this is why. Next up is Maine. This one is also very similar to Connecticut. You can change any time of the year, but the stipulation with this is that you can go to any Medicare supplement of equal or lesser benefits. So you can't go up. In Connecticut, you could go from an N to an F. In Maine, you have to go to the same plan letter or one of lesser value. Next, we have Massachusetts. This one is year-round open enrollment, so you can go to any plan at any time of the year. Massachusetts is a little bit different because they don't have the federalized plans. They'll be state-specific. Then we have New York. They also have year-round open enrollment, so you can go to any plan with any carrier at any time of the year. They also have very high rates. Now we have Rhode Island. Rhode Island is a little bit different because it's not year-round open enrollment. You can only change your plan with no underwriting during the annual election period, which is October 15th through December 7th. During the annual election period in Rhode Island, you can go to any plan with any carrier without underwriting. Next, we have Vermont. In Vermont, you can change your plan any time of the year to any Medicare supplement, but it is only with select carriers. Your carrier has to participate to be able to use the open enrollment rule. And then we have Washington. Washington is open enrollment year-round with a plan of equal or lesser benefit. So you can't go to any plan, but you can go from G to G or G to N. If you're in any of these birthday rule states and you have questions about how they work, or you want a refresher, or you want to shop the market and see if there is maybe a Plan G, a Plan F, a Plan N that is less expensive in your area and might save you some money, give us a call. We'd be more than happy to go over all of your options with you, see what the costs are, and see if it's a good move for you to make that switch. I'll be linking all of this information below in the description so that you're able to see a chart that shows exactly which rules apply in which states. If you enjoyed this video and learned something, give it a like. Share it with any of your friends or family who are on Medicare or in any of these states, and subscribe to our channel. Thanks for watching, and we'll see you in the next video.